After closing for a week, GE Appliances is back open for business, but could employees begin to strike soon? And Kentucky's Governor A&B Blocks is preparing for the surge of positive coronavirus cases where field hospitals are being placed. Good Saturday morning. I'm Marvis Herring. We're so happy that you're joining us right now on WLKY News. It is 6 o'clock. A perfect time to get a check of weather with meteorologist Suzanne Horgan. How's it looking, Suzanne?
Not too bad.
And the novel coronavirus death toll continues growing. Right now, more states are telling people to stay home, and the government recommends that you wear masks in public. Looking locally, Kentucky reported 90 new cases and 6 more deaths on Friday. There's been 831 cases statewide, 37 fatalities total. In Indiana, they have about 3,400 positive cases and 102 deaths. Louisville is reporting 274 cases. 5 more people died, bringing that total number to 14. The U.S. has more than 278,000 cases. 7,100 people have died and nearly 10,000 patients have recovered. More than 40 states who already have some sort of stay-at-home restrictions in place. That includes Kentucky and Indiana. Indiana is extending its stay-at-home order for Hoosiers by 2 more weeks. Governor Eric Holcomb made the announcement during Friday's update. It requires Hoosiers to stay home unless they are going to work or getting essential supplies like groceries or medicine. The order was set to expire Monday night, but now it'll extend through at least April 20th.
Taking the 2-week approach because it gives us, we're more nimble to be able to address the executive order in its entirety and adjust, as I've said many times before, to the facts on the ground. We can go through line by line and tweak if we need to, and we don't have to wait a full month.
Governor Eric Holcomb plans to provide more details about that extension in Indiana on Monday. He also has extended the state's public health emergency until May 3rd. Floyd County commissioners recently passed an economic recovery plan. It's aimed at helping the homeless, elderly, restaurants, and small businesses. The Community Food Initiative allows the county to buy cooked meals from restaurants. Then they give them to community nonprofits. There's also the Fast Track loan. That one provides money so businesses can buy medical products such as PPE. The emergency loan helps businesses that need that immediate support.
Fast Track business is getting back. We're trying to provide a lifeline during this time until we get on the other side of the COVID-19 pandemic.
Also, a small micro loan is given to small businesses with less than 5 workers that can prove that they lost sales because of the COVID-19 pandemic. And this is unique. There's a loan for entrepreneurs looking to create the next big product or supply that will fight the coronavirus. It's 6:04 this morning, and during his daily news conference Friday, Governor A&B Blocks shared data from COVID Act Now. It shows how many Kentuckians could die from the illness if we don't follow those social distancing guidelines. With limited action over the next 3 months, it's projected 47,000 Kentuckians could die. It's a lot more with poor compliance, or excuse me, a lot less with poor compliance social distancing. Some 13,000 deaths are expected. But if we really dig into it and are strict with the guidance, that number may be closer to 2,000.
I believe we have millions upon millions of pieces of PPE that are out there in Kentucky. And again, this is the one we can control. We can't control what we can ultimately procure. We can try. We can work to manufacture it. There are some limitations there. But the one thing, Kentucky, that is entirely in our control that we can knock out of the park is what we donate and what we have on hand.
Governor Blocks is also making a plea for the public to donate personal protective equipment. That includes N95 surgical masks, gloves, and gowns. Employees at GE Appliances are frustrated with how the company has responded to the coronavirus outbreak. Their union is now considering taking a strike vote. The company shut down Appliance Park last week to clean the facility, but employees say it should have remained closed. They claim that the company's efforts to clean and hand out protective gear has done little to protect their health. GE Appliances says the safety of their employees is their top priority, but some employees believe the company is prioritizing profit.
Have compassion for Kentucky. We don't want to keep adding up to the deaths and the exposures.
GE Appliances reopened Building 3 Friday. Production will be suspended for 14 days in the area where the possibly infected employee had worked. And GE Appliances is providing support to workers on the front line of the pandemic. The company is donating 100,000 surgical masks to healthcare facilities in Kentucky and in 4 other states. The Kentucky Cabinet for Health and Family Services, they'll receive 90,000 of those masks. Last week, GE Appliances also donated 2,500 N95 masks to University Hospital, and it's using 3D printing technology to manufacture face shields. And we told you at the top of the hour that President Trump announced new federal guidelines recommending that Americans wear face coverings. The CDC is now encouraging people, especially in hard-hit areas, to use T-shirts, bandanas, or non-medical masks while they're in public. The recommendation is voluntary, and it does not replace social distancing guidelines.
To know that we now know from recent studies that a significant portion of individuals with coronavirus lack symptoms. They're what we call asymptomatic. And that even those who eventually become pre-symptomatic, meaning that they will develop symptoms in the future, can transmit the virus to others before they show symptoms.
President Trump also invoked the Defense Production Act to stop 3M and others from exporting PPE. 3M expressed concerns that this could have significant humanitarian implications and other countries could retaliate. The University of Kentucky announced plans to build a 400-bed field hospital on its Lexington campus. UK Healthcare says the goal is to have the makeshift hospital ready in the next 2 weeks. They'll use Nutter Fieldhouse, which is the football practice facility. University officials do not know if or when they'll need that space, but they want to plan ahead.
Now, as we look at COVID-19, the model and the trajectory of those models vary regarding the scope and the depth of the surge, the timing of when that peak may occur, as well as the impacts on the bed and the capacity of ICUs and ventilators within the state. The real timing depends on how much we flatten the curve.
This week, Governor Beshear announced plans to set up a 2,000-bed field hospital at the Kentucky Expo Center. The Indiana National Guard will begin sending out site survey teams this weekend. Those teams will evaluate potential alternate care facilities. They will consider closed hospital wings or unused large-scale venues. With no specific sites being identified right now, the teams will focus on potential surge locations.
Talked about the actual number of tests that are positive per population being higher down in southeastern Indiana. And we certainly have seen a surge or an increase on our border down there around Cincinnati and around the Louisville area.
The Trump administration has granted Indiana's request for a major disaster declaration that gives the state access to federal funding, including reimbursements for the National Guard. As we all spend more time at home during this pandemic, safety experts warn about the hidden hazards in our houses. Aixa Diaz is in Washington with tips on protecting our families.
Marvis, everyday items in our homes, from furniture to cleaning products, can be dangerous if we're working or cooking and not.
Some good tips there, and the Consumer Product Safety Commission has several checklists on its website right now with steps that you can take at home. That's on cpsc.gov.
What do we want? PPE. When do we want it? Now. What do we want? PPE.
You heard those chants right there. Across the U.S., there's a shortage of personal protective equipment, or PPE, for medical staff working on the front line of the coronavirus pandemic. Nurses in California protested over the lack of supplies at their hospital. They're demanding that the medical personnel at the facility be given N95 respirator masks, something that they claim is being kept under lock and key.
We are here to fight for our PPEs. We're here to fight even just to wear a surgical mask throughout.